Let me show you the different steps involved in the formation of catecholamines. Phenylalanine. In the presence of the enzyme phenylalanine hydroxylase forms tyrosine. Now this tyrosine is taken up by chromaffin cells. This is said to be an active uptake. Tyrosine is converted to DOPA in the presence of the enzyme tyrosine hydroxylase. This is said to be a hydroxylation step, and DOPA undergoes decarboxylation in presence of the enzyme DOPA decarboxylase and results in the formation of dopamine. This dopamine again enters the granule of the chromaffin cells, where it is converted to noradrenaline by the enzyme dopamine beta hydroxylase. This is also said to be a hydroxylation reaction. Now the noradrenaline thus formed enters the cytoplasm, and it is converted to adrenaline, that is, it undergoes a process called methylation in the presence of the enzyme phenylethanolamine N-methyl transferase. This adrenaline again moves into the granule, and hence adrenaline and noradrenaline are formed. Metabolism of catecholamines involves the following steps. Adrenaline and noradrenaline both undergo methoxylation in the presence of enzyme called catechol O-methyl transferase, and adrenaline forms meta-adrenaline, whereas noradrenaline is converted to meta-noradrenaline. Again, they undergo oxidation in the presence of the enzyme monoamine oxidase and result in the formation of vanillyl mandelic acid. Moving on to mode of action of catecholamines. They bind with adrenergic receptor in the target organs. There are two types of adrenergic receptor, namely alpha and beta. Alpha receptor are again divided into alpha 1 and alpha 2, whereas beta receptors are divided into beta 1, beta 2 and beta 3. Norepinephrine, otherwise called noradrenaline, it mainly excites the alpha receptors and to some extent the beta receptors. Epinephrine, otherwise called adrenaline, it excites both of them approximately equally. We are now going to see the different adrenergic receptor types, their mode of action and their response. Alpha 1 receptor activates the inositol triphosphate through phospholipase C. Alpha 2 receptor, it inhibits the adenylate cyclase and cyclic AMP. They mediate more of the noradrenaline action than adrenaline actions. Beta 1 receptor, it activates adenylyl cyclase and cyclic AMP, and it mediates the action of adrenaline and noradrenaline equally. Beta 2 receptor, it also activates adenylyl cyclase and cyclic AMP, and it mediates more of adrenaline action compared to noradrenaline actions. Please remember that these adenylyl cyclase, cyclic AMP and IP3 are all second messenger system. Now we are going to see the different actions of catecholamines. In general metabolism, it is said to be a calorigenic hormone. In carbohydrate metabolism, it causes increased blood glucose level. It does this action by causing increasing glycogenolysis in liver and muscle. Glycogenolysis refers to breakdown of glycogen to glucose. In fat metabolism, it causes free fatty acids mobilization, and this happens in the presence of glucocorticoids. It causes increase in heart rate, force of contraction and conductivity in the cardiovascular system. It also has a general vasoconstrictor effect. Adrenaline causes increase in systolic blood pressure and decrease in the diastolic pressure, whereas noradrenaline causes increase in both systolic as well as diastolic pressure. There is increase in rate and force of respiration by catecholamines. Adrenaline is responsible for flight or fight reactions. Pheochromocytoma. It is caused by tumor of chromophil cells of the adrenal medulla. Rarely, this can be caused by a tumor of the sympathetic ganglia. When it happens so, this is called extra-adrenal pheochromocytoma. The affected individuals will have hypertension. The hypertension that is caused in such a way is said to be endocrine or secondary hypertension. There can be tachycardia, weight loss, sweating and flushing, hyperglycemia, and other metabolic disorders. How to test for pheochromocytoma? Metanephrines and vanillyl mandelic acid in urine and catecholamine level in plasma are measured, and treatment is done according to the cause. Thank you and have a nice day.